ka-CSA, I'm back. This is Miss Love TV. At nandito na naman tayo po sa kay Dr. Contessa Alapag sa CSA Aesthetic Clinic. Ang concern natin ngayon po ay ang pag-continue na paggawa ng ating jawline and neckline. Yan po ang ating gagawin for today. Tapos na ako sa the ultimate cag lift dito sa face. So, anong susunod natin? Kasi kitang-kita naman sa face ko, ayan, talagang as in V-shape na siya, di ba? So, today, we're gonna do the rest of jawline and neckline. Okay, let's go to our next procedure with Dr. Contessa Alapag, only here in CSA Medical Aesthetics.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a topic so-called calf lifting over the jawline and upper neck. Let's all welcome back Miss Lovely Ortega. Welcome, Lovely.
Hello, Doc. Hi. Welcome back sa CSA na naman po tayo.
Right. So before we did a mid-face calf lifting for Lovely, right? And a portion of the lower part of our face. So how was it, Lovely?
I think it's very perfect yung face namin ni Doc kasi because of that 4 months.
Yeah.
So, if you can see talaga, wala na siya din. Pero ito.
Naiwan.
Sabi nga ni Doc,
yeah,
you cannot do in one time lang.
Right.
You need
yes,
to heal first and then
we'll schedule for that part there. So for today, Lovely, we'll be working on this part here, the jawline region, the mandibular line here. We still wanted to tighten and firm this. And after that, we'll be working on this part, the concern of Lovely, below the chin. Right. So below the chin area, we notice for some people, they begin to have this sagginess also. The others call it, like other people have turkey neck, the other people have like just a big bulge of submental fats, or the others have loose skin there. Well, the aging, Lovely,
yes,
it's a continuous process, collagen depletion, elastin depletion, hyaluronic depletion. So we wanted to do something that will really improve this part of the upper neck up to this posterior portion of the neck. So what kind of treatment? What will be our technique? We'll show that when CSA Medical Aesthetics returns. We're back, so we're doing the so-called calf lifting for Lovely. We'll be starting on the lower third of the face, particularly the jawline area. So we still wanted to work on this jowl region here. So we have this so-called tissue laxity already. So we wanted to restore that firmness, that tightness, okay? So anatomically speaking, of course, in this region, when we do the lower third of the face, the demarcation will be for the lower part of our face on the proportions of our face. So the alars to the tragus region, that's the superior border, and the mandibular line is the inferior border, and this is our posterior border and the anterior border. So what we're going to improve here will be this jowl part here. So we wanted to lift it, restore it to its original position. Now, when you work on the lower third of the face, okay, structures that you really have to avoid, we know that the facial artery is coming out from the mandibular notch here. So it goes upward medially, anterior, medially, superiorly, okay? And it branches off to your inferior labial artery and the superior labial artery. And then it goes up to the part, it terminates to your terminal branch of your facial artery. So this is the one that you have to avoid. And plus, of course, from the facial nerve, you have to avoid branches here. Okay, on this part, we know there's a marginal mandibular branch from your facial nerve, okay, in terms of your anatomy. And anatomical layer that you have to place your cog threads, you can use the fat layer there or this mass layer there, okay. I'll be doing a combination of my cog threads as well as my screw threads to really give that firmness and tightness on this part, okay. Then after that, we'll be doing the upper neck region. So for my upper neck, again, superior border is the mandibular line. Inferior border will be just this part here, above the area where we have our thyroid cartilages there, and then posterior will be this part here, okay? And I'll be focusing on this submental region here. So she has this sagginess here and a bulge here. So we still have like submental fats there. Now, PDO threads have been known for lipolysis. They induce a so-called fat cell apoptosis. So somehow, it will help in reducing those excess submental fats. Okay, lovely?
Yes,
So that's for our anatomical considerations and our landmarkings. As to the technique-wise, so if we turn to the left side, lovely. Technique-wise, our entry point will be on, I'll make 2 entry points for this part here for my cog thread, and then direct it towards the marionette line there, okay? So that's for my cog lifting. And later on, I'll be using some of my screw PDO threads too, and reverse direction there, I'll be going towards the ear region, okay, or the lower lobe of our ear. And then for my neck lifting, I'll be using 3 cog threads here. I'll be doing 3 separate entry points going towards the center of the submental region. So this will be my vector there. And on the center region, I'll be also working on with my PDO screw threads. I'll be giving screw threads here just to tighten, firm, and lift this part here and induce the so-called lipolysis and total rejuvenation for lovely. Okay, so those are the anatomical considerations, landmarkings, and technique. How are we going to proceed with our procedure? So for now, okay, so as with any minimal invasive procedures that we do, like injections, okay, it's very significant that you cleanse the area, disinfect the area, and also apply your topical numbing cream. We leave it for about half an hour to more than that, even up to an hour, okay? And I still do the so-called injection of lidocaine. So we'll be making use of our local anesthesia. So we'll be starting at the right side of the face. So we'll be working on the jawline region. We wanted to do further jawline definition for lovely. Now for the anesthesia, so numb the entry point here for your cog. So entry point there, and then 1 cm interval, entry point there. And then you can also do your mentalis nerve block there. So your mentalis foramen is over this region. And then make an entry point here, puncture it. And I have my PDO cog thread, 360-degree spiral type of cog thread. And then I'm gonna insert it perpendicularly and just glide it towards the marionette region. Okay, so just glide it. So you can go to the superficial fatty layer or to this mass layer. So when you're using cog threads, if you have thicker strands of cog, you can just direct it in this mass. And there are cases we do it sub-mass layer. So direct it to your marionette region. Okay, so some resistance there, which is already expected because we have some mandibular ligaments here. Okay. So we just have to push it towards that line there. Inhale, exhale, lovely. So directing it towards that part there. Okay, there you go. So just glide it and we're gonna pull it out. And after that, we'll proceed to the second one. So entry point again, make a puncture there. So you follow just the mandibular line here. Okay. So if you want to restore that good jawline, well-defined jawline, you can do this technique, this cog lifting on the mandibular region. Okay. Just direct it so it's like a lateral vector here, lateral pull. So towards the inferior marionette region. So inhale lang. There's some pressure there. Okay, there you go. And pulling out. So then you can cut the remaining strand. So we're done with the lower face cog lifting. Then I'll combine also with some of my screw threads. So I'll use a screw thread that's very long. Okay, so this is a 90mm type. So that will just have one insertion point there, and just glide it following your mandibular line there, and you're already reaching your posterior part of the lower third of the face, and you can already pull it out. So this is a longer screw type of PDO thread. So the needle is kind of like thin. It's just a 27 gauge needle. So you can already reach the posterior part. So we are helping the tissues restore the collagen formation. So you're stimulating fibroblast cell and convert them into the so-called myofibroblasts for stronger contraction of those tissues there. Then let's do the right side upper neck. So for my entry point, so inferior to my mandibular bone here, and following the line from your lower third of the face, you can make your entry points here. So 3 entry points there. So we'll be using the same PDO cog thread, spiral cog thread. So make your puncture here. So the purpose is to lift that saggy tissue, upper neck region. And then we'll just glide it towards the center of the upper neck. Okay, so this is a cog spiral, 360 degree. Okay, just glide it towards the center. And we're just gliding. So expect some resistance initially, okay? And you can like change the position of your anatomical layer, especially when you're doing the neck region and submandibular region. So you can change. You're just going into the soft tissue layer there, and you wanted to reach that submental region, submental aspect of the upper neck. So you can reach towards the center, just glide until you see the sponge, white sponge there, and pull it out. Okay, so second cog, so 1 cm apart. So I use a needle that is gauge 19, and my cannula is also gauge 19. So ideally your needle is gauge 18, so one size bigger than your cannula gauge. So just insert into the soft tissue layer of the upper neck. Okay, so I'm reaching already the center. So the goal is to pull the saggy soft tissues here. So the cog threads have barbs in them, or cogs in them. In that strand of your cog, you have those hooks or barbs, and those barbs will grasp your soft tissues and cause that lifting and firming and tightening effect. So I'm nearing the center of the upper neck. So this is already my third, and there you go. So I'm done with the 3 cogs for the upper neck region. Then we'll proceed to the left side. So this is the cutting of the remaining strand. So when you're cutting, not too much of a pull, Just the right tension there. So let's proceed to the left side of the face. We're proceeding to the left side, so I'll anesthetize my entry point, 2 entry points for my jawline definition, and then do your mentalis nerve block here. So for my first cog, entry point here. So ideally you use a gauge 18 puncture needle because I'm using a gauge 19 cannula loaded with my cog threads. So direct it perpendicularly at first and then slant it to this position here and just direct it towards the marionette line there. Done. This is the third one. Okay, just switching that saggy tissue there, and so we've done the 3 cog thread for the left side upper neck. So just a pull there and push your scissor. So this is a scissor for cutting sutures, okay. Or you can use your iris scissor too, and then do a massaging there. So you can actually massage the path of the cog thread and kind of do a pressing on the entry point because this is really so tight. So for my final technique, final procedure, I want to tighten this further. I'll be using the so-called screw threads for the submental region, and I'll change my gloves again. So now for my screw threads in the submental region, I can use a 40mm, a 50mm, okay? And we're just gonna insert it in the subcutaneous layer, okay? So actually, screw thread is different from those plain smooth thread. The screw thread is just like in a needle, the PDO is like coiled around that needle. So I have this. It's not same as the monoplane, so you'll see or you notice in the needle it is coiled around that needle. So actually this has a stronger collagen stimulation as compared to the plain smooth type because the spiraling or the coiling, it triggers more of your fibroblast cells in that dermis and subdermis layer. Okay, so we're working on the submental region. So initially, I'll just be doing a linear pattern here or like a ladder pattern here. So I can use 5 of these PDO screw threads. So subcutaneously inserted, and I'll do the other side, okay? So this is like a parallel pattern or a ladder pattern, and you can even do like a diagonal pattern for this one. So in terms of like placements of the PDO threads, it's ideal that you have a good system, a good pattern, so that the dermal fibroblasts will really have that good, like it's like a template that they will follow. It's something like we wanted it to be systemic or organized. I mean systematic. Okay, so we can still do a vertical approach like this to really strengthen the skin, the subcutaneous layer here. So you can do like a vertical approach there, inserting perpendicularly like that. So again, you're really targeting the deep dermis to the superficial subcutaneous layer. So this is what they call a tolerable procedure because we were able to anesthetize a while ago. So as to the number of threads, it will depend as long as you have that equal distance from each other. So you can still add some more just to give a more of a tighter, sexier under chin for lovely. Okay. So if you have more, you can still just add in a space that you need it. Actually, we've seen reports that it helps in those acne scars. Okay, so because of the strong collagen stimulation, it can really improve also those sunken acne scars, depressed acne scars. So we have patients whereby they did this procedure, they had those sunken or depressed scars. We've seen a lot of improvement. So we've done PDO cog lifting and also the screw threads. We'll show the result to Lovely when CSA Medical Aesthetics return. So we'll show the result now to Miss Lovely. So here's our mirror, Lovely. You can check already the result of your cog lifting lower third or the jawline or mandibular line plus the upper neck region. And we've done a lot of insertions together with those screw PDO threads. And actually, I'm already appreciating an instant lifting effect. It was really so tight and firm when I was touching the part where we worked on. So Lovely, how was it?
Ayun, Doc, wala talaga ako naramdaman.
Yeah, it was painless. We had a good numbing there. We had a good mentalis block.
That's the
nerve block.
important kasi.
Yeah. So we were able to give that anesthesia or like an injection of our local anesthesia, because that's also important. Yes, indeed, you're right, because others are really scared of it. These kinds of procedures, they were saying it looks painful, but it's really tolerable as long as we were able to give that good anesthesia injection. And I can see already that the smoothness on the jawline region, and then the prevention of the marionette line, and it's really tight. And there's already like a reduction of the submental bulge there, but the PDO threads will still work in a span of like 3 months or the 12 weeks neocollagenesis. There will be more of a regeneration of those tissues from inside. That's why you'll still see more of the lifting. And right now, there's gonna be a beginning contraction of those soft tissues inside. So as days pass by, we'll see more of improvements and more of a tightened and lifted upper neck region, the jawline region. So Lovely will just get younger and younger. She's restoring her youthful look. So again, this is non-surgical. This is like a quick procedure. We can do it in our clinics. Okay, it's a safe technique. And of course, make sure that you go to those licensed physicians who were trained to do these kinds of minimally invasive procedures. Actually, not all doctors are doing this. So it will depend on what is the specialization of the doctor. If they were able to go through these trainings or like workshops, they've really done it and did a hands-on workshop. And there's also like certification for doing this for licensed physicians.
True.
Right. So thank you so much, Lovely, for
Thank
again
you,
being with us.
Yeah.
And I think some of our televiewers may have some questions about what you've done today.
Yeah.
Meron kang Instagram? Or
just
Facebook?
Facebook and
Facebook, yes.
and also sa YouTube.
Thank you for sharing with our televiewers. So yan, if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Marugol, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. The other videos of Lovely, you can see them or check them at our YouTube channel, Contessa Salvador Alapag.
Yeah.
So, God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.